We need a new suction.
With the dexterity of a carpenter and the tools of a painter,
Okay, turn it.
this surgeon is using stem cells to do something on the frontier of modern medicine, grow brand new bone.
These are the stem cells and platelets. This is plasma, and these are the red cells.
Dr. Thomas Einhorn is using the stem cells to try to repair a patient's hip after 7 conventional surgeries failed. This is the very first time he's tried this kind of surgery.
That's the excitement for me, is to develop new things and to help people as a result.
Orthopedic stem cell surgery has been practiced by only a handful of doctors nationwide. Its proponents complain that medicine involving adult stem cells like this is underfunded because it's often confused with controversial embryonic stem cell research. But these stem cells do not come from embryos. They come from the patient himself.
You were spray painting basically with adult stem cells.
With live cells.
His own live cells.
His own live cells. A higher concentration of which now have the ability to make some bone.
Einhorn removes stem cells from the patient's bone marrow, drawn from his own pelvis, using some for the spray paint and some for what he calls grout.
And so by mixing the bone marrow cells with this protein, it gives me a grouting material that I can use to fill in some of the gaps.
But today, the procedure earned significant backing from the federal government, which announced it's dedicating $250 million for veterans injured in Iraq and Afghanistan. The hope is the new funding will offer wounded soldiers a chance to heal from injuries that might otherwise have left them unable to return to work or even walk.
It has application to some challenges that might have previously cost patients their leg because we didn't have a way to heal their bone.
$42 million of the federal grant goes to the Cleveland Clinic, where Dr. George Mushler pioneered the surgery.
And clean out the area of tissue that hadn't formed bone. And
over the past 6 years, he's been monitoring his patients. He's convinced that orthopedic stem cell surgery does actually result in the growth of permanent, strong, new bone. Monique Biggins was one of the first to try the surgery. A classically trained pianist, nurse, and mother, she suffered a debilitating injury indulging her passion since childhood for playing softball.
I was running after a line drive and my foot got kind of stuck in the turf and my body weight was just propelled forward and the shoulder took all that impact. And as soon as it happened, I immediately knew something was wrong. And at first I thought I just dislocated my shoulder, not realizing that I'd fractured the clavicle.
First, it was a plate and 5 screws, multiple surgeries, and even a traditional bone graft. Over a 2-year period, nothing worked. She had to stop working. She couldn't lift a grocery bag, much less play piano or softball. In time, her spirits were just as shattered as her collarbone.
It was devastating because I couldn't play the softball, couldn't play my piano. I couldn't do anything.
And finally, she was told by her doctor she was out of options.
He came out and said, you know, this is the worst broken collarbone I've ever seen. And it was actually fractured in 2 spots. There were 2 breaks in the bone. And he said, I don't know what to do with you.
She'd heard about Dr. Mushler. She was a nurse at the Cleveland Clinic. She agreed to try the experimental surgery.
I'm always inspired by Monique in particular because of the way she initially sought out care and the courage that she had to be one of the first people to accept this technique and to be willing to undergo it.
He explained to me that they just extract the bone marrow from your bone, from the iliac crest, and they extract the stem cells. And this made total sense to me.
The way we explained this was that we don't know if it's going to work any better. We don't know if it's going to work at all, although it seems to work in every place we've tested it so far.
I want to be careful with my terms, but she basically volunteered to be your guinea pig.
Yes, in a way.
For Monique, it was an experiment worth trying.
It was a miracle, it really was. It was just like a miracle.
Because why? Why was it a miracle?
Because, I mean, you could see it in an x-ray, there's just like a gap, there's no bone, and then later on there's a solid bone.
He grew back your clavicle, your collarbone.
Exactly.
If it weren't for the stem cells, if it weren't for Dr. Mushler?
I probably would have lost, you know, function of my left arm eventually.
The government is now banking that the same surgery that helped Monique play softball again with her daughter and once again play the piano will provide new hope for wounded veterans. This is Juju Chang for Nightline in Cleveland.
Sunday, with the Democrats still at it, a This Week exclusive, John McCain one-on-one with George. So what's he really have to say about the competition? Sunday, don't miss This Week live from its new home on Pennsylvania Avenue at Washington's Museum.